Welcome and thank you for joining us today for Maxar's webinar on infectious disease response planning with geospatial data. My name is Camille Cassidy and I'm Senior Manager of Global Marketing at Maxar and your host for today's presentation. Before we get started, here are a few tips to keep in mind while viewing today's presentation. All attendees are on mute. To ask a question, please use the Q&A feature that is located at the bottom of the screen. We'll save about 10 minutes to take questions at the end of the presentation and take them in the order they were received. Attendees also have the option to view the webinar in full screen. To view in full screen mode, please click the View Options tab located at the top of your screen. And lastly, a link to today's webinar recording will be sent to everyone via email in the next couple of days. As I mentioned, the topic for today's webinar is infectious disease response planning with geospatial data. This webinar will be presented by Alicia Williams, Geospatial Supervisor with the Maxar Analytics team in Tampa, Florida. So without further ado, I'd like to welcome Alicia and all of our attendees, and let's begin today's webinar. Take it away, Alicia.
Hi, good morning or good afternoon, everyone, depending on where you're joining us from. Welcome and thank you so much for attending. My name is Alicia Williams and I'm a Geospatial Supervisor in Maxar's Tampa office. And as Camille said, feel free to answer any questions using the Q&A function and I'll be happy to answer as many questions as I can at the end of the presentation. According to the World Health Organization, infectious diseases are estimated to be responsible for more than 15 million deaths globally each year. Human mobility like air travel, public transportation hubs, transport exchanges, medical health facilities, socioeconomic factors like weaknesses in public health infrastructure, and poverty are all important factors in modeling pandemics. We'll dive deeper into these data layers in infectious disease modeling a little later on in the presentation. It's important to have an understanding based in both time and place in order to determine how and where a disease is transmitted so that officials can develop effective control measures. I'm sure everyone listening has been impacted by the social distancing measures to some degree. We need to understand the impact of these social distancing measures in order to try to flatten the curve. I'm sure many of you have seen this graph on the news a lot lately, but flattening the curve is basically an attempt to slow the spread of the infection enough to not overwhelm the capacity of the healthcare system so that we don't have more infected individuals than hospital beds and staff. On February 19th, Iran announced its first deaths from COVID-19. And on March 1st, large trenches were visible for mass COVID-19 graves. That's just a couple weeks later. So this is an extremely rapid decline, which shows just how time sensitive the situation is and the need for a quick response. Now let's talk a little bit about how Maxar data has been used to aid in modeling of recent Ebola outbreaks. Proximity to notable features informs decisions about where to drive relief efforts and how to transport aid to those areas. Maxar's human landscape data sets identified the locations of key points of interest, such as medical facilities and clinics, in disease-affected areas like Monrovia, Liberia. Sociocultural layers, such as access to improved sanitation services, were important for modeling the Ebola outbreak in Liberia in 2014. Improved sanitation refers to the percentage of households with access to an unshared flush toilet or an unshared covered pit latrine. Ebola is spread through direct contact with infected bodily fluids, so improved sanitation is imperative for minimizing the spread of the disease. Sociocultural layers also informed response teams where high density populations were located, specifically low income communities with higher risk of contracting the disease. In this case, the Equateur province had the highest percentage of the population living under the poverty line, and also had the most significant outbreak of Ebola in 2018. This outbreak saw 54 cases of Ebola with 33 deaths, and that's a 61% fatality rate. It was also the first time that an experimental Ebola vaccine was disseminated in the early stages of an outbreak, and it's likely the reason why the outbreak was able to be contained to the Equator province alone. So with the usefulness of Maxar data now confirmed during recent Ebola crises, let's talk about how it can be used to model infectious disease in the current COVID-19 climate. Key points of interest layers in Iran were mapped to model infectious disease outbreaks. Points of interest important for disease modeling includes airfields, tourist attractions, and public transportation as possible locations for transmission of viral outbreaks. Airfields and public transportation points of interest are important because people from either local or international hotspots can pass through, easily spreading the disease. Medical facilities are important to know for locations of treatment, but also as possible transmission sites due to the high concentration of infected people. And as I mentioned before, water infrastructure is important for sanitation purposes because they can be locations for disease spread. And polio is an example of a disease that can be spread through infected water. So on the date that this data was gathered, there were 4,397 cases in Tehran, 1,646 cases in Isfahan, and 593 cases in Semnan. As you can see here, Tehran by far had the most cases, but this is to be expected because it also has the highest population density. So we can begin to do some geospatial analysis and mapping in order to glean more information on the situation. So when we map COVID cases normalized by population, Semnan actually becomes the standout. Tehran might be the most densely populated, so it's expected that it would have such a high rate of infection. But Semnan, on the other hand, is not nearly as populated. So for the cases to be so high is anomalous. While more research needs to be done, this could very well be due to the proximity to Tehran. It can be inferred that infected persons from the Tehran hotspot are traveling to nearby Semnan and spreading the infection there. Next, we mapped medical facilities as a ratio of population density in order to quickly identify at-risk communities where the number of medical facilities is insufficient to treat the likely number of infected persons. The provinces in darker red colors indicate locations where the number of medical facilities is far lower than necessary compared to the population. As you can see here, Alborz is a province that's at high risk. It has a low number of medical facilities compared to its relatively high population density. And as we know now, the close proximity to Tehran also puts it at higher risk. So as we continue to delve deeper into this type of analysis, we also mapped medical facilities as a ratio to the population density of ages 65 and older. In this case, Khuzestan was actually one of the standouts. It has the highest density of people over the age of 65, which is the most at-risk group for complications from COVID-19. It also has a relatively low number of medical facilities relative to the population over 65. Continuing with the geospatial analysis of human landscape data for Iran, I completed an ordinary least squares model in Esri's ArcMap, utilizing the COVID-19 dataset layers. The results were very promising. It produced an adjusted R-squared value of 0.88. And as you can see here in the histogram of standardized residuals, it did indicate an unbiased model as it pretty well followed the natural curve. So to put it simply, an adjusted R-squared value is used to determine how much of the story the data tells. In this case, the human landscape COVID layers alone told a great majority of the story at 0.88, which could be said to say that it tells 88% of the story. Perhaps some more details can be teased out, but an initial result of 0.88 is very promising. And despite neighboring countries' efforts to close the border, the terrain and border infrastructure throughout the region permits illicit cross-border movement, which occurs on a daily basis. This analysis here revealed how smuggling networks have thrived for decades and present increased health risks to neighboring countries during this COVID-19 pandemic. Particularly, you can see how Iran's borders with Iraq and Pakistan have higher densities of unofficial border crossings. So these countries would be at higher risk of importing COVID-19 cases, even if they were to close their borders, because there's such a high density of unofficial border crossings. So now let's talk a little bit about how Maxar's data is analysis ready. According to research, 80% of the work of a data scientist is cleaning and preparation of data rather than actually mining or modeling that data. So our goal is to alleviate as much data preparation time as possible so that analysts can jump straight into advanced analytics. Disease modeling users note that our data is easy to understand and use right away. There's no need to learn codes in order to understand the data, something that really sets our data sets apart from others out there. Imagery basemaps add a foundational view of your area, while building footprints help to identify where populations are clustered. And human landscape data helps to determine critical service availability where people gather. Maxar imagery basemaps provide an accurate, consistent, and actionable satellite image layer that supports mapping, visualization, and analytics at local, regional, and global scale. Ecopia building footprints, which are powered by Maxar, are GIS-ready polygons generated by the most sophisticated and advanced high-resolution satellite imagery, artificial intelligence, and cloud computing power available. It enables users to detect and classify infrastructure at scale with precision. And human landscape is a country-by-country data set of geospatial data across 8 core themes. There are more than 60 data layers per country. And this means that some data sets have more than 1 million features per country. So it's a lot of data. Data sets are delivered in ready-to-use, easy-to-navigate formats, and they're compiled from hundreds of sources by our expert analysts. And of course, it's designed to support advanced analytics within the Esri platform. Based on scientific research regarding pandemic modeling, end users found the following layers to be particularly useful: transport interchanges, amenity centers, healthcare centers, and demographic data. So for this reason, we're offering truncated human landscape data sets with only these layers included so that we can ensure a quick delivery. Data is collected at the lowest administrative level possible. Information collected can consist of either point, polyline, polygon, or raster data. Information is vetted against multiple sources. Machine learning or crowdsourcing is used to validate the sources or the data, further increasing accuracy. And we have expert analysts that enhance the data using any open sources available. This can include anything from peer-reviewed journal articles to local news sources. We also have thorough quality control measures in place to ensure overall accuracy and consistency throughout data sets. Our geospatial human imagery verification effort, or GeoHive, is a vetted crowd of online users who view high-resolution Maxar Technologies satellite imagery. The crowd can discover, validate, attribute, and annotate features in a fraction of the time that it would take an analyst. So as you can see in this image, this is an example of a task we can send to the crowd. For a country with thousands of parking lots, this task could take a single analyst days or even weeks to validate. However, we can send this task to the crowd and it can be validated in only a few hours. Maxar also has a growing collection of machine learning classifiers and machine learning data creation tools that we use in our production efforts. And these classifiers have upwards of 90% confidence scores. Another thing that sets apart our human landscape data sets is the depth of attributes that we add to the data. Analysts use multiple sources to fill in as many attributes as possible. And there's easy access to the attributes within the feature class. So here you can see the types of airports. Right here you can see that they're all listed as commercial, but there are many possible types, including military or both. We can also validate based on imagery how many runways there are and whether they're paved with asphalt or concrete, whether they are grass or dirt airstrips. And we also are able to measure the length and width of the airstrips based on satellite imagery. So you can see you aren't just getting locations of airfields. There's so much more depth to the data. And when a data set is purchased, we deliver everything in ready-to-use formats. This includes a geodatabase file, a symbolized map document, which can either be an ArcMap MXD or an ArcPro project, whatever the customer prefers, and a booklet that describes the data. We have several countries that are ready for immediate delivery, which includes Guatemala, Iran, Iraq, Japan, Northern Territories, Libya, Moldova, Oman, Pakistan, Papua New Guinea, Yemen, and several provinces within China. And we also have several countries that were completed fairly recently that could be updated very quickly. And these would be ready for delivery in only a couple of weeks. We also offer a monthly spotlight product where our analysts leverage Maxar solutions to provide organizations with early insights into economic, military, environmental, and political changes around the world. This periodical is free of charge, and it helps readers to gain a better understanding of how Maxar's Earth intelligence capabilities can help reveal patterns of insight critical in times of crisis and conflict. So feel free to sign up at the link listed here. And what I've been discussing thus far is how to use the data for your own analysis. But if you're interested in using our team of expert analysts to do an analysis for you, we also have a dedicated team that produces comprehensive analytic reports. So here's just some pertinent contact information. If you're interested in any of the products mentioned, feel free to reach out to Camille. Thanks so much, everyone, for attending, and I'm happy to answer any questions that anyone might have.